The United States healthcare system is unlike many across the globe. One of the biggest differences is in regards to insurance, as the United States is the only developed nation without some form of a universal healthcare coverage plan. While there aren't two countries that have truly identical systems, several are very comparable. For example, Canada and Taiwan are the only two developed countries with a true single-payer system, which means there is only one way to obtain health insurance and there are no private plans. Where countries such as the UK, Australia, France, and Singapore all have a hybrid universal plan that provides health insurance for all through the government, but there are also private payer add-ons available. However, in the United States, there are several different systems offering coverage both private and public. And most of the time, this results in overlapping services for those who have chosen additional services, or lacking coverage for those specifically in the underserved category. These variances and lack of coverage, along with other influencing factors, have significantly affected the cost of care, the quality of care, and the access to care for a large part of our population. In addition to understanding the state of insurance in the United States compared to other developed countries, it is also important to address cost, quality, and access to healthcare in this discussion to understand how the United States compares to other countries on these metrics. By understanding where other countries have experienced success or pitfalls, the United States can learn and develop plans accordingly to best fit our diverse population. The following statistics are from 2018 and come from the Peter G. Peterson Foundation as reported in July of 2019. The data shows that the United States GDP was nearly 5% higher than the next closest country, which was Switzerland, and double the established goal average for share of healthcare spending in all OECD countries. These countries are primarily the more developed countries that are in Western Europe, Australia, and then some in South America. Additionally, per capita spending in the United States was $3,000 more than the next highest country, and again, double the established OECD average. When we break down that spending, we will see that the majority of it is due to administrative costs, where we spend 3 times as much, while we spent significantly less on long-term care compared to the other countries. I find this last graphic to be the most interesting. As you can see, the left side represents the best health outcomes for each country, while the right represents the worst category. On every measurement, the United States doesn't even come close to the center or the average on these graphs, except for the very last metric, the average for heart attack mortality rate. With these skewed metrics, we must ask ourselves, what are we doing wrong? And why are we spending so much more compared to other countries to receive only subpar results? These high costs and poor outcomes directly affect our nation's economy and well-being, and it is important to understand why cost, quality, and access need to be at the forefront of health reform discussions. First, let's look at cost of healthcare in the United States. As I mentioned earlier, it is clear that the United States spends exorbitantly more on healthcare each year compared to every other developed country. These costs can primarily be traced back to the lack of a standardized system for healthcare that is present in the other countries. The current system allows for high administrative and drug costs, along with defensive medicine practices performed by physicians. This defensive medicine refers to the fear experienced by physicians that they will face legal action if they don't run every test in the book, even if the test isn't completely warranted. Therefore, stressing the importance of evidence-based medicine in this case would help to reduce these unnecessary and costly decisions, and additionally provide physicians with a slight relief that they have a set way to handle a situation. Using evidence-based medicine, if a patient was to come into the hospital after listening to their chief complaint, the attending nurse or physician would be able to make a quick and effective decision on the way to proceed with the patient based on scientifically supported evidence about these symptoms. An example of this would be with any recent virus such as the coronavirus. If a patient is complaining of one of the main symptoms of coronavirus, Due to the evidence available, the physicians and staff on hand will immediately know how to address this situation and won't waste time or resources on other testings. This quick decision-making, in turn, reduces wasted time, increases patient satisfaction, and reduces costs from unnecessary testing. There are other ethical and moral concerns with this process, such as that it removes authority from the physician, but in general, it will help reduce the ambiguity of not knowing the best way to proceed, and it will help to reduce time and wasted procedures. Additionally, competition among insurance companies and healthcare providers has continued to drive up the cost of healthcare. This is something that under a government-run healthcare system is easier to control. In addition to evidence-based medicine, cost transparency could provide another way for physicians to help reduce healthcare costs. By providing physicians with the upfront cost of each intervention method and sharing that information with the patient, the two can make an informed and cost-effective decision about the best intervention method for that patient. This will instill confidence and a sense of ownership in the patient while also helping to contain high drug costs. The second factor in this discussion is variances in the quality of care delivered to patients in comparison to the rising healthcare costs. It is evident that the United States pays exorbitantly more for healthcare than any other country, and as I've discussed, the outcomes are subpar at best. However, compared to 100 or even 50 years ago, we've come a long way in improving our health outcomes. Combined Peterson and Kaiser Health Foundation reports that since 1980, the United States mortality rate has fallen from 1,184 deaths to 837 deaths, and the United States now has one of the lowest sepsis rates in all developed countries. In 2016, the Agency for Healthcare Research and Quality presented 3 ways to improve the quality of care in the United States. First, we need to achieve better care for patients by using care coordination, counseling, and patient education. By having a comprehensive care plan that outlines the patient's needs, it is easier for both the patient and the provider to maintain and monitor the care delivered. Second, we need to achieve healthy people by optimizing population health. This focuses on the disparities to care in the United States based on race, ethnicity, and/or socioeconomic status. By addressing this factor and providing outreach to susceptible groups, healthcare quality and access can both be improved. The final aim is to make care affordable for everyone. This goes back to the original premise to implement a universal healthcare type coverage system. With the current fragmentation in healthcare, we are facing too many variances that are rapidly increasing costs. Controlling this could provide relief in more ways than one. Finally, access to care is a constant battle in the United States. This is a result of 2 issues. 1, rural areas where healthcare organizations are sparse, and 2, individuals with minimal or no coverage are unable to receive care that is close to them. Solutions such as telehealth visits and outreach clinics in underserved areas could provide low-cost alternatives to increase the amount of care in these areas. It will be important moving forward that insurance plans help to cover telehealth visits, as this can not only improve access, but help to decrease the spread of infectious diseases. Looking at the data presented by the CDC, access to needed healthcare services has slowly started to improve, while access to needed prescriptions due to cost has steadily increased. If we take a look at this chart, for needed medical care, you'll notice a decline from 1997 to 2005, then a jump in 2010, and now back in a decline in 2017. This could be due to the insurance changes and rollout of the ACA around the time of 2010, but it is promising that in 2017, every metric across the board saw a decrease in not receiving necessary care. This shows that current initiatives are helping the situation, but it is clear much more could be done to address this concern. Areas where we could see improvement include poverty level, low education, and individuals between the ages of 25 and 34 years old, as these represent the highest rates for not receiving the needed care. We can combine these 3 metrics of cost, quality, and access together to form the concept of the healthcare iron triangle, which was first introduced in 1994 by William Kissick. This helps to explain that influence these three concepts have on our economy. 3M reports that the iron triangle in healthcare refers to the concepts that access, cost, and quality cannot all be simultaneously improved. The premise is that an improvement in one area results in a decline or a change in at least one of the other areas. This can be simplified by the fact that an increase of quality of healthcare will almost always lead to an increase in cost or a reduction in access. However, certain approaches have begun to challenge this idea in order to disrupt the triangle. Utilizing bundled payments or adjusting shared savings can help to eliminate unnecessary services, therefore leading to a decrease in cost, while access and quality can remain unaffected. 3M reports that 20 to 30% of medical spending could be eliminated with no adverse effects on patient outcomes. Utilizing Lean and Six Sigma practices could also have similar effects, as their premise is to reduce variances and unnecessary waste in the system. By eliminating unnecessary processes and procedures to create a more direct and streamlined process, cost would be able to be decreased, while quality and access could be vastly improved. However, through waste elimination, it will be important to remain cognizant of the influences of the iron triangle. When everything is appropriately managed, organizations will be able to overcome the debilitating effects on the healthcare and the economy. It is clear that reducing cost while simultaneously increasing quality and access to care is not a straight line, immediate fix. It will be important to understand the ramifications of each action taken to address these issues in order to prevent widespread havoc on the system. We simply can't just reduce one of the things without facing the effects downstream. A carefully mapped out plan will need to be provided to ensure a feasible and economically sound solution to the current state of the United Healthcare system.